Now for GI cancers. In this video, we're covering the key points for esophageal cancer, as well as colon and colorectal cancer. So starting with esophageal cancer, this is when there's cancer within the esophagus, the food tube, that takes food from the mouth and into the stomach. So the key point is the risk factors. So write this down. Acid reflux or GERD that goes untreated for years ends up scarring and destroying the esophagus lining, leading to Barrett's esophagus. Basically, a thick, red, destroyed esophagus. So write that down. Commonly tested is acid reflux as a big cause for esophageal cancer. And for the other common risk factors, just think OAT here. O for obesity, or a BMI over 30, A for alcohol, as well as T for tobacco, including smoking and chewing tobacco. Now switching gears to colon and colorectal cancer, or cancer of the colon. This includes the large intestine and the rectum, that exit door of the GI tract. So the main risk factors include diverticulosis and ulcerative colitis that is long-term. So just think anything that causes destruction, just like esophageal cancer with that GERD. So diverticulosis is that little outpouching pockets all over the large intestine, which can lead to flare-ups and inflammation called diverticulitis. Now, ulcerative colitis that is long-term, this includes open sores all over the large intestine, resulting in bloody stools during flare-ups. Now, these two conditions cause destruction of that large intestine here, leading to a high risk for colon cancer. So the HESI mentions, which disorder does the nurse suspect in an elderly patient with a history of diverticulosis who reports rectal bleeding? The correct option, colon cancer. Now another risk factor is family history of colorectal cancer. So family is a big factor that's commonly tested, specifically for colorectal cancer here. And the other risk factors is OAT. O for obesity, that BMI over 30, A for alcohol, and T for tobacco. So we included cigars here because it's cigarettes, cigars, and even chewing tobacco. Now for the signs and symptoms of colorectal cancer here. Number 1 is unexplained weight loss. Huge NCLEX tip. I would write that down. And we also have the ABCs here. A for abdominal pain, B for bleeding. Key terms is blood and stool, as well as low hemoglobin. And C is for change in bowel habits. So write these down. These are commonly tested for colorectal cancer. So when you get a question about a client with a family history of colorectal cancer with unexplained weight loss here, key term, and a change in bowel habits, and a hemoglobin value of 9 when compared to 14 just 12 months earlier, which diagnostic test is expected? We must expect a colonoscopy to check for that colon cancer, since all high risk factors are for colon cancer here. Now, speaking of diagnostics, a colonoscopy, we're just sticking a scope up the butt, or the rectum, I should say, to check out the colon. So let the name help you here. Colonoscopy, we're just scoping out the colon here. Specifically in colorectal cancer, we're scoping out for tumors or even polyps that may be cancerous. Now, colonoscopy is also used in other GI issues, like ulcerative colitis and even Crohn's disease, to scope out the colon there. Now, there are some key interventions before and after a colonoscopy. So before, we do clear liquid diet with laxatives. And we give the patient a big, huge jug of polyethylene glycol. Brand name is Go Lightly. This huge jug of liquid helps to clear the bowel and allow the scope to take a good look. And lastly, NPO after midnight before the procedure. Now, after the procedure, it's priority to monitor for perforated bowel with peritonitis. This is a medical emergency. It's very deadly. So write down these key terms here. Fever, tachycardia with tachypnea, abdominal distension, and a rigid board-like abdomen. Write that one down. Huge NCLEX tips here. We must report any of these findings to the HCP immediately. Trust me, this has been tested multiple times in various question banks. Now for key teaching after the procedure, we recommend a high fiber diet, and for some reason the key term cabbage came up on a lot of question banks. And we use the acronym OAT. O for obesity, we teach the patient to lose weight. A for alcohol, we have them stop or reduce. And T for tobacco, we use smoking cessation here. So Kaplan mentions dietary alterations for a client with a family history of colorectal cancer. Add, key term, cabbage to the diet to reduce the risk of colorectal cancer. And lastly, an interesting question from Hesse here. The nurse is caring for a patient with cancer of the small intestines. That required the removal of the duodenum and jejunum, basically just two parts of the small intestine here. The nurse knows that the patient will have difficulties with which physiological process? And the answer is digestion. Well, obviously, guys, if you're removing part of any part of the intestine, naturally we're going to have digestion issues. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and